Today, I want to talk about 6 can't miss diagnoses for hypoxia. That means when you have a patient who comes in hypoxic with a saturation less than 90%, you want to rule out these six things because they can be really bad. I remember them by the word MET, M-E-T, and then the 3 letters BPD. The M stands for myocardial infarction or a heart attack. Be on the lookout for chest pain and usually get a trope and an EKG. The E stands for embolism. Usually I like to think about pulmonary embolism, so try to get a CTPE if needed. The T stands for tamponade, cardiac tamponade, which usually presents with hypotension, pulsus paradoxus, and oftentimes echo findings are helpful. B stands for Boerhaave syndrome, which is esophageal rupture in someone who might be vomiting. P stands for pneumothorax, and D stands for dissection. So usually get a chest x-ray, and dissection often presents with hypertension. Make sure you rule these 6 things out for hypoxic patients. Follow for more. Peace.